Good morning, good afternoon, good evening. Welcome to another lecture for the Counseling 5480 course Diagnosis and Treatment Planning. In this lecture, we're going to talk about schizophrenia spectrum and other psychotic disorders. The chances are you probably have heard of schizophrenia, but how much do you really know about it? Let's test it out. I prepared 8 different statements about schizophrenia. See if you can tell the difference between the true statements and the false statements. Schizophrenia is a rare illness. What do you think? This one is a false. The prevalence of schizophrenia worldwide is about 1%. Basically, in every 100 people, there's one person who have the symptoms that meet the requirement or the criteria for schizophrenia. Schizophrenia is a brain disease, true or false? This one is true. Based on the brain imaging techniques, aka the MRI and PET scan, we are able to see that among people who struggle with schizophrenia, there's a change in the structure and functioning of their brain. So yeah, it is a brain disease. Schizophrenia usually strikes older people, true or false? This is a stigma. I can understand that. Unfortunately, it is true. Sorry, it is false. Because surprisingly, to some people, schizophrenia actually have a comparatively early onset. The onset age for this disease is usually between late teens and mid 30s. Schizophrenia is caused by poor parenting. This one is false. People with good parenting can develop schizophrenia. People who received poor parenting don't necessarily develop this disease. Next one, schizophrenia is caused by street drugs. This one is also a false. Similar to the previous one, people who use drugs don't necessarily develop schizophrenia, and people who don't use drugs can still develop schizophrenia. But I'm gonna say, so like for people who use drugs, they can show some of the symptoms that can be confusing uh, from the schizophrenia symptoms like hallucinations and delusions. Yeah, so which is why it's really important for us to screen out the drug abuse or the substance use issues before we give them a proper diagnosis. Okay? The next one, people who have schizophrenia are usually violent and dangerous. True or false? This one is a big false. It's a very sad stigma and stereotypical thinking, and it's an assumption for a lot of people. But this is really not true. Later on, we're going to talk about the positive symptoms and negative symptoms. And so hopefully you can have a better understanding of this, and next time you can, advocate for people who have schizophrenia as far as to against this kind of a stereotypical view. All right, people with schizophrenia have multiple or split personalities. This is a definitely false. Last week we just talked about DID, dissociative disorders. So yeah, that's probably the chapter people should look at when they're thinking about people with multiple identities. Schizophrenia can be successfully treated. True or false? This one is a true. However, there's a difference between being treated and being cured. So schizophrenia may not be cured, but the symptoms can be managed and can be treated. And the people who struggle with schizophrenia can still have a good quality of life if they're able to manage their symptoms very well. Okay, here are some more facts about schizophrenia. As we mentioned before, the prevalence is about 1% of the population worldwide. This special group accounts for 50% of psychiatric inpatients, two-thirds of all homeless people, and as there's no gender difference as far as prevalence, but there is gender difference as far as the age of onset. So males develop schizophrenia in their early to mid-20s, whereas females develop the symptoms a bit later, so they don't develop symptoms until in their late 20s. And most of the time, people do not get schizophrenia after age of 45. And schizophrenia is um, rarely occurs in children, but we should be aware of the childhood onset because it is increasing recently. Even though substance abuse is not a causing factor for schizophrenia, 30% to 50% of people with the disease actually use or had used substance in the past. 20% of this population attempted suicide. 5 to 6% of the population die by suicide, which is really, really sad. DSM-5 takes a spectrum approach in this chapter. As you can tell, all the psychotic disorders are organized based on the increasing degree of psychopathology. When talking about psychotic disorders, in this lecture, we're going to focus on the 5 domains as following. They are delusions, hallucinations, disorganized speech or thinking, grossly disorganized or abnormal behavior, and negative symptoms. All right, delusions refers to the fixed false beliefs that cannot be corrected by any reason. So people with delusions, they don't know that they're delusions. They're convinced that they're real. They can't really tell the real from unreal. And at the bottom of this slide, there is a video. It's a YouTube video that you're welcome to check it out. It is an interview of someone who is describing their delusions. So there are many types of delusions. In this box, I have made a list of a few common types. So let's go through each one of these to see what they meant or what they are. The first one is persecutory delusion. This refers to the belief that someone's going to be somehow harmed by either other people or specific organizations or some groups. Some of the common examples of persecutory delusions include the fear of being watched or followed or being poisoned or conspired against. The second one, erotic type. This delusion refers to the belief that someone is just crazily loved by another person, and usually this person has some higher status. And it could be a complete stranger, it doesn't matter. So I actually had an example here. When I was in China, I've seen a female client and with this type of delusions. She was convinced that she's loved by a Chinese pop star. So like we were listening to a pop song and she just told me, hey, this person, the singer, really loves her and the song was written for her. The next one, grandiose type delusion, is the mistaken belief or being particularly talented, or they have some special powers, or maybe they are related to a famous person or a powerful person. And I also personally have seen a male client. He was telling me how he knows what the president was thinking about. and that's a special talent of his. And then the jealous delusion refers to the belief that their partner is cheating, and this one is commonly found in men than women. Somatic delusions refers to the delusions that are related to their body functions, especially like maybe their body smells or their organs are not functioning very well, or someone's body is rotting from inside out. So just something's wrong with their body when in reality everything's perfectly fine. Nihilistic delusions involves the conviction that something catastrophe will occur, some disaster will occur. And then on the right side, there are three different common types of what is called a bizarre delusion. So bizarre delusions are the kind of delusions that don't make sense. I know that like the previous one, you probably also think they don't make sense, but at least they're logical. At least you're able to understand. It sounds like it makes sense when they explain to you. But the bizarre delusions just don't make sense. They're illogical and they're just unreal. So there are three different types. The thought withdrawal refers to the belief that someone's thoughts has been removed by some supernatural force, and right, that doesn't make sense, but that's one of the bizarre delusion. Thought insertion is the opposite, that they believe that some thoughts from outside have been put into someone's mind. And then the last one, delusions of control, refers to the belief that someone's body or actions are being acted or manipulated or controlled by some outside force. And there are, can be other examples. Um, for example, like someone is convinced that their internal organs have been removed and replaced by maybe aliens without uh, without leaving any wounds or scars, but they're convinced that their organs have been taken away. It's just bizarre. Hallucinations refer to a false sensory perception that occurs in the absence of an external stimulus. It's like the picture that you're seeing right now on the slide, but it's actually not there. So that's a hallucination, which is different from illusion. If someone is experiencing illusion, they are seeing a picture, and in reality, there is that picture. It's just their version is a bit distorted from the actual picture. So there are different types of hallucinations based on human senses because, again, hallucination refers to a false sensory perception, right? So different types are auditory, visual, olfactory, which basically means smell, gustatory means the taste, and tactile. The most common hallucinations are auditory hallucination. These auditory hallucinations can be experienced as either noises, could be noises of certain machine or just unknown noises, could be music, or could be voices. The voices can be clear and distinct, or it could be vague, can barely hear it, but there are still voices. The voices can be experienced as someone who's whispering to people, to you, or someone's shouting at you. And voices could be from one specific person, or it could be from multiple people. The voices can be like a male or female voice, child voice, elderly people's voice. It could be anything. An example would be that there are voices telling clients to not take medication or telling client to just hurt themselves, cut themselves. And then most of the times the client try not to listen to the voices, but I mean, if you are hearing those voices all day long, convincing you to harm yourself or harm others, it's kind of overwhelming, isn't it? Disorganized speech is confusing because there's not much of a logic or any connections between the ideas that has been presented. This made it extremely hard to communicate with that person. Specifically, something called looseness of association is the hallmark characteristic of schizophrenia. This type of disorganized speech featured in no logical sequence or relationship to thought patterns. Again, there's not much of a logic or connections between different ideas. So, for example, I could be saying, I love fast food. All the rabbits have four legs, and it can be dangerous to fly in the sky. And I just made that up. And there's no connections between my ideas, but that could be something that we are experiencing for someone who have disorganized speech. And there are some other common types, um, something called neologisms, refers to making up new words that are not existing anywhere. Echolalia refers to just simply repeating another's words. Clan association is the meaningless rhyming of words. Word salad is just a mix of all the meaningless words and phrases together. And tangentiality refers to the occasion when the answers to the questions are just totally unrelated to each other. And as always, at the bottom of the slide, there is a YouTube video for you to understand a little bit more about what it looks like, what disorganized speech looks like. Disorganized behavior or abnormal motor behavior can be manifested in many different ways. Some of the examples include odd gestures and mannerisms, taking off one's clothes in public, repeatedly making the sign of a cross, assuming or maintaining certain postures, and so on and so forth. People with disorganized behavior or abnormal motor behavior cannot complete everyday tasks such as bathing, eating, dressing appropriately, or preparing for simple meals. There's a special type in this domain which is called catatonia. Catatonia refers to the marked decrease in reactivity to the environment as far as someone's move. It almost seemed like to me that the person is moving like a robot. It's very rigid and the movement of their body is very limited. Historically, catatonia has been associated with the diagnosis of schizophrenia. However, catatonic symptoms are not only associated with schizophrenia. They can occur in other mental disorders as well, such as bipolar or depressive disorders with catatonia, or maybe in some other medical conditions. And in the DSM-5, usually catatonia is a specifier that you can add if the person have this kind of symptom. If you're curious about what catatonia may look like, you're welcome to pause the lecture right now and then use the link at the bottom of this slide to check out a YouTube video on someone who has catatonia. People don't usually realize this, but there are actually two different types of symptoms for psychotic disorders. At this point, all the symptoms that we have talked about so far are called positive symptoms. They are all like the addition of human functioning. And the negative symptoms, on the other hand, refers to almost like a loss of the ability in performing human functions. I'll give you some examples. Sometimes some people will lose their ability in expressing their emotions using their face, eye contact, their speech, movements of the hand, movements of the head and face, um, and yeah, so those things are lost. And this phenomenon is called diminished emotional expression. It's just like the picture on the side. Um, they're using a flat face for all kinds of emotions. Another type is called avolition, which refers to the decreased motivation. Not when I say this, it doesn't mean that I've lost my motivation to study. No, I'm talking about some like daily activities, such as talking to people, socializing or stand up, walk around, right? People experience avolition. They can sit there for a very long time without feeling bored. The next one is called alogia. So this one refers to the diminished ability in talking. So like they have no problem just without talking. The next one is anhedonia. I believe we have talked about this in the earlier weeks of our class. So this one refers to a decreased ability to experience pleasure and joy, regardless of any kind of, positive stimuli. Like things usually make people happy don't work anymore. People with anhedonia just always feel depressed. And the last one I want to talk about here is called asociality, which refers to the lack of interest in social interaction. So basically, um, they just don't have the intention to socialize with people. This can be presented along with the avolition. Remember the one, people just sit there for a while without talking to anyone. The comparison of positive versus negative symptoms result in the following differences. As early as childhood, people with positive symptoms appear to be odd, irritable, and they also display aggressiveness, whereas child with negative symptoms appear to be withdrawal and passive. Women or female tend to display more positive symptoms, whereas males tend to display more negative symptoms. Positive symptoms actually um, generate better prognosis, whereas negative symptoms generate worse prognosis. People with positive symptoms respond better to classical antipsychotic meds, whereas people with negative symptoms have a poor response to classical antipsychotic meds. They would be better to it would be better to use a newer antipsychotic medications on these people. So in this chapter, there are 5 major schizophrenia spectrum disorders. I have made this what I call it a cheat sheet to help you quickly identify the features of each of these disorders. So people with delusional disorder display delusional symptoms without any other psychotic symptoms, and the duration of this one is over a month. People with brief psychotic symptoms, psychotic disorders, have an sudden onset of psychotic symptoms. How sudden? It can be as brief as 1 day to as long as 1 month. People with schizophreniform disorder also display psychotic symptoms. And the duration for this one is 1 month to 6 months. And then schizophrenia display psychotic symptoms as well as the very familiar significant impairment of functioning. Duration of this one is more than 6 months. And then the last one we have here is schizoaffective disorder, where people display or people experience both psychotic symptoms as well as mood episodes. Since we went through all the psychotic symptoms already, I don't want to talk about those symptoms here, but with schizophrenia diagnosis, you may feel a bit overwhelmed by the number of specifiers that they have. But if you look closely, most of the specifiers you have already seen from the previous disorders. And so I will also not spend time explaining what each specifier means. One thing I do want to mention is that you can have a choice of either use or not use the severity specifier, which is the one that specify the severity as mild, moderate, and severe. Now let's look at schizoaffective disorder, since this is a bit special in this chapter. It's almost like a combination of a psychotic disorder and a mood disorder. So the hallmark of schizoaffective disorder is an uninterrupted period of 2 or more weeks in which all the psychotic symptoms, which if you still remember, like the delusions, hallucinations, disorganized speech and behaviors, and a mood episode basically means the manic or depressive episodes coincide. Symptoms of major mood episode, usually depression, must be present for more than half of the duration of the illness. In addition to that, there must also be at least 1 2-week period of the time in which delusions or hallucinations occurred without a major mood episode. And that's how you differentiate from a depressive or bipolar disorder with psychotic features. So the best treatment for psychotic disorders are a combination of both pharmacological and psychosocial interventions. But during an acute psychotic episode, the medication is probably the primary form of the treatment. The treatment goal is to provide the safety to reduce the psychotic symptoms and any other symptoms, including mood symptoms, and so that the person could come back to their normal functioning or as much as possible. And then there's also maintenance phase, and this is where counseling skills could shine. So when the client is in remission, the treatment goal is to promote the recovery and the stability and help them to reduce the likelihood of relapse. So some of the method we can use here is to focus on the social skills training, focus on improving their self-esteem, and find ways to prevent the relapse. A recommended assessment for people who struggle with psychotic disorders is the clinician-rated dimensions of psychosis symptom severity. This is an 8-item measure which evaluates the severity of psychotic symptoms, including delusions, hallucinations, disorganized speech and behaviors, as well as negative symptoms. When it comes to treatment, a really good model is to use a multidisciplinary team to provide integrative care for people with psychosis. And that team could include a counselor to provide individual counseling, could also include a psychiatric nurse or psychiatrist to provide psychiatric medication evaluation. Based on or depending on their life skills level, case managers can be assigned as well. And usually, group counseling is very important for them to provide that peer support as well as a good environment for them to learn and practice social skills. As far as counseling approaches, um, there are several modalities that have been proved to be effective based on the literature. They are assertive community treatment, cognitive behavior therapy, acceptance and commitment therapy, as well as family psychoeducation. So yeah, psychoeducation is huge for this population, not only for individuals themselves who struggle with the disorder, but also for the caregivers. And just keep this in mind. I know, although most of you probably do want to use insight oriented approach because and that's almost like the training for most of the courses that you're receiving, right? But the insight oriented or especially something similar to psychodynamic therapies um, do not work very well with this population. And finally, you have reached the end of this lecture. I hope you find this information helpful and instrumental in addition to your weekly readings. And don't hesitate to reach out to me if you have any questions. If you feel more comfortable sharing your opinions and questions anonymously, feel free to share them on our class Jamboard. I appreciate your attention and listening to this, and I look forward to seeing you in class.